Okay, good morning, everyone. I'm very happy to have you all here. Not everybody is here yet, but I think a lot of people will still come. But we're very, very happy that you're here. Welcome. With almost all of you, I've had personal email contact, so you all know me. I don't know every one of you, but I'm sure that in the next 1.5 days, we will get to know each other better. So, very welcome to Rotterdam, this breezing, exciting city in the Netherlands. It's a well-kept secret, but this is the nicest city of the Netherlands. Okay, I hope, half of you will join us at the conference dinner tonight. We're going to have a boat tour, a small boat tour, and we're going to have dinner in Hotel New York. I'm going to talk about that a little bit later. Just to explain you the practicalities of today and the program, I'm going to give you a short presentation about this. Okay. We have 117 people who have registered, so participants. We're very, very proud on that because we really hadn't expected it, but so it's really wonderful. Half of you is from the Netherlands, but fortunately the other half is from other countries, and we have about 15 different countries present here. Only one person from Germany. Could you please stand up? Okay, great. Yes, you're there. And we also have some people from the northern countries. Norway, Kirsti, I hope I'm going to pronounce your name correct. Yes, there you are. A lot of people from Denmark. Can they stand up, please? Oh, okay, they're all in one row. Oh, okay, that's the Danish row. Okay. Sweden is also well represented. Yes. Oh, yes, there's some more. Okay. We also have 2 guests from the United States. Yes, there you are. Okay, thank you very much. And from Canada, there's also 1 participant. Do I see her yet? Not yet. Okay, a lot of people from France as well. Bonjour. Okay, okay. And UK is also very well represented. Thank you. Despite all the strikes, you're here. Great. Or perhaps you are on strike. I don't know. Okay. And as you can see, we also have a number of PhD students. Very well welcome here. And we also have some invited speakers, but most of you are paying guests. Thank you very much. Who's working in research? Could you please stand up? Yeah, we have to do a little bit of exercise because otherwise... Okay, quite a few. Wonderful. Thank you. Okay. And how many of you are working in clinical practice? Also, wow, look at this. Wonderful. Great. Okay, thank you. So who are we actually? We have a lot of nurse specialists who are present. Very welcome. This also shows that nurses and nurse practitioners are playing an important role in transitional care. But we also have a lot of doctors in here, so we are also very proud of that. And we have a lot of people who work as psychologists, occupational therapists, physiotherapists. So we also have some allied health professionals and some other people who are mainly researchers, but also some other ones. There's also 1 educational specialist here, so that's good to know. And I've also listed down the various interests we have, and as you can see, the various fields are quite well represented. Okay, who's working in adult care? Wow! This is wonderful because a few years ago when we had these conferences, there was virtually no one who was working in adult care. So we are really progressing in this field. And I hope that this conference will really make clear that this is not a pediatric issue. It is a pediatric issue, but not only a pediatric issue. So I'm really happy to see so many of you working in adult care as well. we're standing, we're in giant footsteps, so to say. Juan Carlos Juris Granel, he organized the previous conferences, partly together with Christina. This is the 4th symposium we're holding. It's the first time it's outside of Switzerland. And we're very pleased to thank them for their wonderful work. Juan Carlos is now he's retired, so he's not here today. But Enora, she is the linking pin. She's there. Please stand up because you're one of our organizing committee. Thank you. So this is the organizing committee. Here are the 4, there's an all-female team, very strong team, I would say. Jane, are you here? Jane is here. Thank you. And Enora and Jane, and together with Marielle. Marielle, she can't stand up, but she's there. We rated the oral presentations and the posters, and we have a wonderful support team. They have a small question mark on their badge, so if you see them and you have a question, you can go to them. You can also ask me, because if you are in distress or if you have any problems, you can phone me. My phone is currently lying over there, so you can't phone me at this moment. But you can call me. This is my phone number. Just call me if there's anything wrong, if you don't know the way, if you're lost, whatever. You need personal assistance, I'm here for you. 24 hours per day. Okay, here's the Wi-Fi. It's also in your book. It's on the first page of the book, or rather, it's down here. You can find the Wi-Fi code here. And it's also here. Check everything in the book. In the program book, there's the program, but also the list of the presentations, the sessions, where you have to go to. It's not very complicated, but the time schedule is quite tight, and I'm going to keep you all to it. So hopefully it's going to work out fine. Okay, so next one. You have received this bottle. It's not plastic. It's sugarcane. And you can put it in your dishwasher. It's safe. I tried it before. I'm going to say this. It's a Dutch initiative. It's called Join the Pipe. And they make these city bottles for almost every city in Europe. And if you buy one bottle, you give one bottle to a child in an underdeveloped country. And they also provide clean drinking water. It's meant to fill with tap water. It's safe in the Netherlands. You can drink it. You don't get ill from it. But I thought it was a nice initiative, and I thought it was good to support it. So if you haven't picked up your bottle, go and get it from the registration desk. The program. We're going to have some plenary speeches in the morning. After lunch, we will have other sessions. But we will start with the different plenary speakers. I'm not going to introduce them all. They introduce themselves. And during the lunch break, we'll have poster session. You can walk along the posters. And you all received 3 little stickers. And you can give these stickers to the posters you like best. And we're going to vote for the best award. We're going to give an award to the poster with the most stickers. So if you are a poster presenter, you know what to do. You have to ask for your stickers. If you don't have your stickers yet, you can just go to the registration desk and get them there. There's also an award for the best oral presentation. The person who wins the best oral presentation gets his registration fee back. Well, that's nice. And you're going to get, when you go to one of those sessions, you'll receive a voting card, and you can just put a cross on the presentation you like best. And tomorrow morning, in the end of the morning, we will hand out the awards. Here are the program sessions, the parallel sessions. You didn't subscribe for those. You can just go to the one you like best, and you can check in your book which presentations are where, so you can select one of them. I would not suggest that you go from one room to the other, because that's a bit stressful, but select one of the rooms, and I think they're all interesting. Unfortunately, I cannot put myself into 4 pieces, because I would like to see them all. And here you can see where they are. Some are on the 4th floor, and one is on the 1st floor, and there's one session here in this room. After the tea break, there's one more plenary session, and then we're going to have the workshops. And the number on your badge is the number of the workshop you registered for. And we're counting on you to go to the right session. Okay, so 1, 2, 3, 4, it's in the book. So if you have number 4, like me, you're going to go to the Essential Interventions 1. Then afterwards we'll have networking and drinks, probably here in the foyer, because it's raining and I don't want to stand in the rain. And then at about 6 o'clock, those of you who are going with us to the conference dinner will assemble in the hall here, and we'll walk down to the river where we're going to get a water taxi. There's enough room for everyone on the boats, but not for everyone. So if there's anyone who's going to the conference dinner on their own means, by bicycle or by car, whatever, just let me know, because then I know that I don't have to swim. Okay, tomorrow morning we'll have 4 parallel sessions again. Same procedure. We'll start with a short wrap-up and also with a short presentation on what happened in the workshops. And then we're going on with the parallel sessions. And after the coffee break, we'll have a round table with several of the invited speakers, and we're going to have the awards. I already said this, there are 10 posters, there are 2 tables with materials, and there will be people explaining to you what you can pick up most of the materials, and you can give your stickers to the posters you like best. So we have only 10, you have 3 stickers, so it shouldn't be too difficult, I hope. And the best oral presentation, we have a very complex calculation system, but just vote. That's the most important thing. Okay. So this is what the rooms look like. We are now in the Bibliotheek Theater, which is here on the ground floor. And the Desiderius room is on the 1st floor. And this is, of course, the name of Desiderius Erasmus, who is originally from Rotterdam, as you know. The Black Zaal is on the 4th floor, and the Film Zaal as well. And the workshop you selected is on your badge. I hope this is going to work out fine, because we didn't register for the parallel sessions. If it's full, please go to another room, because we don't really want any trouble with the library here. The conference dinner is at Hotel New York, which is this very small little building on below. This is a very important spot for the Netherlands, because this is the place, used to be the former headquarters of the Holland-Amerika-line, where all the emigrants, mostly from Western Europe, departed from to go to the United States. And from here, thousands of immigrants left for New York. And today, it's in the 80s and 90s, the area was completely deserted, and now it has been turned into a hotel and a restaurant. And we're going to have dinner there, and we're going to go there by boat. We have 8 tables with 8 guests, so 64 people have signed up for the conference dinner. We have a table setting to make sure that not all the Danish people go together in one Danish table, but we have split you all over. So it's going to be all people you don't know, so hopefully this is going to be exciting. And after the first round, we're going to change, and you have to go to another room, another table. When you enter the restaurant, Jane will give you your card, and it says which table you have to go to first and second. So it's all very well organized and thought out, hopefully. And I hope you like the idea that you're going to switch tables. Perhaps for the last round you can sit with your friends. Okay, so 64 people will go to the conference dinner. It's really exciting, really happy to have so many guests. Thank you. So this is the water taxi we're going to go in. We have 5 water taxis for each 12 people. They depart at 18 at 6:30 from the quay number 43. It's down there, it's on the river. As you can see, we are there. So it's not far. We don't walk too far. If you want to go to your hotel or whatever, in the meantime, you can do so, but make sure that you're there at 18:30. There are 3 taxis leaving at 18:30 and 2 at 18:45. And it's only a few minutes because, well, if you look at this, I'll just show it here. We're going to depart from there, more or less, and then go there. It's quite exciting. So for any questions so far, any worries, Oh, I'm going to say to you, the people that have oral presentations, if you haven't handed in your presentation yet, please do so during the break. Near the registration desk, you can hand them in. And you will receive a small gift, freshly baked yesterday, for all the work you've done so far. This also goes for the invited speakers. You can also go and pick up your little gift. So the posters, I think most of the posters are already hanging there, and you can look at them anytime you wish. And there's a special request to look at the posters during the lunchtime. But they will stay there for the rest of the conference, so you can look at them at another time. Any questions? Did I forget anything? No, Inora, she's shaking no? No, Jane? No? Okay. Okay, Jen, there is some time left, so I can give you a little bit of introduction on our own work. We started 20 years ago with working on this particular issue of transitions in care. When we started, I had to explain what is a transition. Nowadays, I have to explain what do we actually mean by this transition? And because we're talking about transitions all the time, energy transitions, system transitions, I don't know. But nowadays I really have to explain this is what we are talking about. We started with On Your Own Feet programs in 2004. And so far 3 PhD theses have come out, loads of papers, publications. Many of you know the work. But we have been always focusing on the combination of research and practical innovation, quality improvement. And I'm very proud that still most of the teams that we have worked with are still working with their original transition plans and their original programs. Also showing you that it is really worthwhile to invest in working together with teams and make sure that the work is continued, because all too often when the doctor or the nurse who is responsible for a transition program leaves, then the whole thing collapses, and that's really a shame. But I think we have been working hard enough, and working intensely with teams is really helpful. So we developed this framework. We're going to use it in one of the workshops as well, because we think that transition should be holistic, an integral approach, and it should not only be about transferring the young person from A to B. So it is important to improve the organization of care, but also we should work on empowering young people. We're going to discuss what it means, because we have different ideas about this all the time, but it's also important to enhance self-management and independence of the young person. This should not be done without the parents' involvement, but of course parents are an important part of it, etc. So this is one of the things we work, and I think we are very proud that we finally managed after 20 years. So don't despair. If you're only working on this field for 7 years, you still have some time to go. But we managed to develop a Dutch quality standard. It's mostly based on the beautiful work that was done in the United Kingdom. The NICE guideline, we didn't copy it, but we used. Most of the recommendations have been taken over. And I think this is just also to give you an idea, it's not necessary to develop anything from scratch. You can start from what we already have and what is already there. And these are the main principles, and it was developed by a group of young people, professionals from all kind of different fields, patient, parent representatives, and also some experts. I think it was very nice that there were also some people from adult care involved in developing the standard, and we're really working hard on putting the principles into practice. And that is the theme of this conference. So we developed these talking boards. They are on the website, so if you want to download them or have a look at them, and they are also here, so you can pick one of you can pick them up if you want to. There's one that explains the road from the professional's perspective, which is the big one, and the other one is from the young person's perspective. And if you look at them closely and you look for the differences, you can see that in the professional perspective, the hospital and the hospital care or the healthcare provider's perspective is very much present there. Everything that's green is, we are very much focused on our own world. And for the young person, it's a long and winding road, and it's mainly outside of our scope, outside of the hospital or outside of the rehabilitation clinic or whatever. So I think we like the idea that there are two different perspectives, and that we have to keep in mind that what is important to us is very often not so important to the young person. Okay, this is a Dutch saying. It's not very... Well, the people from Rotterdam are very much into this idea. I would like to translate it as this. And we're going to give a good start by today's lots of talks. So I'm going to invite the first speaker, which is you, Imelda, to give the first plenary talk. And hopefully after the conference, we will get back to action.